Introduction: imagine your heart, the tireless engine of your body, gradually weakening under the constant assault of alcohol. This is the reality of alcoholic cardiomyopathy, a serious heart condition that develops as a result of long-term, excessive alcohol consumption. It's a sneaky disease, often progressing silently until significant damage has been done. This video will delve into the depths of alcoholic cardiomyopathy, exploring its causes, effects, and the steps you can take to protect your heart. Etiology: the root cause of alcoholic cardiomyopathy is chronic, excessive alcohol intake. But what exactly does excessive mean? While definitions vary, generally it involves drinking more than recommended daily limits for an extended period. The amount needed to cause damage varies from person to person and is dependent on sex, genetics, and other pre-existing health conditions. The longer you drink heavily, the greater the risk of developing this debilitating condition. There is no set safe level of alcohol consumption, as individual susceptibilities vary significantly. The higher the amount of alcohol consumed and the length of consumption increases risks. Other conditions like poor nutrition can exacerbate the issue. Pathophysiology: alcohol's toxic effects on the heart muscle, called the myocardium, are central to alcoholic cardiomyopathy. Over time, alcohol damages the myocardial cells, disrupting their structure and function. This leads to a decrease in the heart's ability to contract forcefully and pump blood efficiently. The heart chambers, especially the left ventricle, become enlarged and weakened. Fibrosis, or scarring, occurs in the heart muscle, further impairing its ability to function properly. As the heart struggles to meet the body's demands, it enlarges, leading to a condition known as dilated cardiomyopathy, a hallmark of this disease. In time, this puts the body in a state of heart failure. Epidemiology: alcoholic cardiomyopathy affects a significant portion of heavy drinkers, though the exact prevalence is difficult to determine due to underdiagnosis and varying diagnostic criteria. It's estimated that a notable percentage of individuals with long-term alcohol abuse develop some degree of cardiac dysfunction. Men are statistically affected more than women, likely due to historically higher rates of alcohol consumption. However, women tend to be more vulnerable to the toxic effects of alcohol on the heart and may develop the condition with shorter periods of or less alcohol use. Alcoholic cardiomyopathy also frequently occurs with other alcohol-related health problems, such as liver disease and malnutrition. Race and ethnicity may also play a role in the prevalence of the disease, but more research is needed to fully understand these disparities. Signs and symptoms: the symptoms of alcoholic cardiomyopathy often develop gradually, making early detection challenging. Many people may not realize they have a problem until the condition is quite advanced. Common symptoms include shortness of breath, especially during physical activity or when lying down. Fatigue and weakness are also prevalent, due to the heart's inability to supply enough oxygen to the body. Swelling in the legs, ankles, and feet, known as edema, can occur as fluid backs up due to poor circulation. An irregular heartbeat, or arrhythmia, is another sign, sometimes felt as palpitations. Chest pain, although less common, can also occur. As the condition progresses, these symptoms worsen and can significantly impact daily life. Diagnosis: diagnosing alcoholic cardiomyopathy involves a combination of medical history, physical examination, and diagnostic tests. The doctor will ask detailed questions about alcohol consumption habits and past medical history. A physical exam can reveal signs of heart failure, such as an enlarged heart fluid retention and abnormal heart sounds. An electrocardiogram, or ECG, is used to assess the heart's electrical activity and identify any arrhythmias. An echocardiogram, an ultrasound of the heart, is crucial for evaluating the heart's size, shape, and pumping function. Blood tests can help rule out other causes of heart failure and assess liver and kidney function. In some cases, a cardiac MRI may be performed for a more detailed view of the heart muscle. It's important to note that the diagnosis is often made by excluding other possible causes of cardiomyopathy, especially in those with a history of excessive drinking. Treatment and management: the cornerstone of alcoholic cardiomyopathy treatment is complete abstinence from alcohol. This is critical to prevent further damage and allow the heart a chance to recover. Medications are often prescribed to manage heart failure symptoms, such as diuretics to reduce fluid retention, ACE inhibitors or ARBs to lower blood pressure and improve heart function, beta blockers to slow the heart rate and reduce stress on the heart, and digoxin to strengthen heart contractions. Lifestyle modifications are essential, including a low-sodium diet, regular exercise is tolerated, and weight management. In severe cases, advanced therapies like implantable cardioverter, defibrillators, ICDs to prevent sudden cardiac death, or even heart transplantation, may be considered. Regular follow-up with a cardiologist is crucial to monitor progress and adjust treatment as needed. Prevention: the most effective way to prevent alcoholic cardiomyopathy is to avoid excessive alcohol consumption. Adhering to recommended daily limits, or better yet, abstaining completely, significantly reduces the risk. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also protect your heart. Early intervention is key. If you or someone you know is struggling with alcohol abuse, seeking professional help is essential. Treatment programs, support groups, and therapy can provide the necessary tools to overcome addiction and prevent long-term health consequences, including alcoholic cardiomyopathy. Prognosis: recent research or advances. The prognosis for alcoholic cardiomyopathy depends on several factors, including the severity of the condition at diagnosis, the individual's response to treatment, and their ability to abstain from alcohol. With complete abstinence and proper medical management, some individuals can experience significant improvement in heart function. However, in severe cases, the condition can be progressive and lead to heart failure, arrhythmias, and even death. Recent research is focusing on identifying biomarkers that can help detect the disease earlier and predict its progression. Studies are also exploring new therapeutic targets to protect the heart from alcohol-induced damage. Genetic research may eventually help to identify individuals who are more susceptible to developing alcoholic cardiomyopathy, leading to more personalized prevention strategies. The field is continuously evolving, with the ultimate goal of improving outcomes for those affected by this debilitating condition.